There's so much about anxiety alone that people just don't understand. There's a lot of psychosomatic nature to anxiety. It's everything all coupled into one. How many times have patients come to me with this laundry list of medical issues that were all related to either anxiety or depression? Once we tackled the underlying main disorder, no longer had IBS, no longer had sleep dysfunction, no longer had insomnia.
Now, welcome to the podcast today. Very excited. We have Dr. Mona Amini on with us, and she is the founder of Mind Over Manolos Psychiatry. So welcome, Dr. Mona.
Thank you, Brad. Nice to have you interviewing me today, and I'm excited for this.
It's going to be really good. And especially we're going to be speaking about mental health, which is
Yeah.
something that it's funny because with mental health, a lot of us don't talk about it very much. And, on the podcast, I haven't really had a mental health expert such as yourself. We've really touched on the challenges of an entrepreneur, and, you have these ups and downs, and,
Mm-hmm.
sometimes we can get together and commiserate about, our industry, and, some of the challenges we have with our peers. But as you work with so many professionals, Dr. Mona, do you see certain industries impacted more than others with mental health?
The spectrum of mental health and mental wellness, I think it affects everybody. I don't know if there's necessarily like one unified body or career position per se that is affected the most. In fact, when I was early on in my training, what they had talked about to us as MDs was historically the most affected increased burnout and stressful careers were more along the lines of high depression rates, high anxiety, that kind of thing. And those professions were historically psychiatry, dentistry, anesthesiology, some of the kind of like more heavy hitter demographics of mental health affecting MDs and physicians. But I actually think that mental health, because of the increased awareness nowadays, we're seeing this less stigmatized in a way, and we're seeing a lot more focus on it, and we're seeing and hearing a lot more of this in any and every industry. So I would say that dependent on where you're at in your life and maybe the hierarchy of where you are in your career, most likely, and I think we all have found this as business owners and entrepreneurs, that the higher you go and the higher you level yourself up in your career and in life, the more stress you're going to have. Ultimately, you need to build more resilience. I mean, there's a lot of time demands, and there's a lot of interpersonal demands. There's a lot of people that are under you that expect the highest quality at all hours of each day. And so executives get a lot of this brunt of the pressure. And so probably athletes, executives, people that are in high intensity positions that are consistently in that realm probably are hit the most.
It's interesting you say that, because I was just going to give the example of athletes. I mean, I think when
Mm-hmm.
you talk about less stigmatized, the mental health, you're seeing that even in sports. I'm an avid sports guy, and they're talking a
Me
lot
too.
about how mental health is such a big, issue. And you think about how toxic it can be with, politics and all these other aspects
Oh,
out
yeah.
there. With social media, how have you seen that take a toll? From your clients and just industry professionals, executives, all the different now areas that they have to manage, and from the public perspective.
I think that's a great question. And in fact, I was talking to one of my patients about this just the other day. You can go into a really, really bad rabbit hole, downward spiral when you're attentive and, to the social media. So if you're somebody who's really high up there in the food chain as an athlete or as a professional, as an influencer, whoever you are, you've got millions of followers, and there's a lot of negativity. And I feel that you've got to have the capability to just turn that off. You have to have the understanding that there needs to be boundary setting on your part, whoever it is that you are, and understand that there's a lot of mental health education out there, and we're trying to help others, but in a subset of the population, people have the capability to feel entitled to say their opinion behind a computer screen or behind their phones, almost anonymously, but not really anonymously. You're still, forthcoming in what your opinions are, and you're going to speak that. And I mean, we see this to address to athletes all the time. They have a really great week. They, hit all their goals, and they're doing a really great job. They could have even broke a record that weekend, in football with however many yards. And there's still people that will say, hey, my parlay didn't get this, on my betting. And, and they'll say that, and they'll comment on these poor athletes' Instagrams or, Twitters or X, whatever it is now. And it's sad, but I guess that's mainstream social media nowadays. And it's an added stress. It's an added stress to whoever it is you are, whether you are an athlete, whether you are an executive, you're an influencer, you are somebody really high level that has a lot of followers. But on the other side of the spectrum, you're going to have to deal with a lot of the negativity on that side. And you're going to need to have the capability to be very resilient in your thought process and how determined you are to shut that noise out. And I know a lot of celebrities that have actually said they don't even check their accounts. They've got somebody managing it. They'll post and things like that, but they're not reading comments. As soon as you read that, it's a bad rabbit hole to fall under.
Yeah, it's really good advice. What's interesting is, the application for us. I mean, I think of as a builder, and I've talked to other builders about this. I mean, the
Mm-hmm.
profession's incredibly complicated. It's very stressful. You're managing people and trades and partners and suppliers and,
Right.
clients that have these deadlines, right? We all do. And for a lot of reasons. And what's interesting is many of us, I think in any industry, you could have, 8, 9, 10 amazing clients, right? That's why you do what you do. You have
Mm-hmm.
these amazing
Oh,
clients, and then, then you get one that, seems to spoil it for the rest, right? That just is that constant, uh, and not to point fingers on what it is, but you may have someone that's just dragging you down for whatever reason. And,
yep.
social media could be that. And you mentioned that, to your point, there's a lot of people that don't go down the rabbit hole of looking at comments. You've spoken a couple of times about resiliency, though. What, how does someone become more resilient? What are signs of mental stress that we're having? How do you build resiliency towards those?
It's uh, it's a consistent and dedicated effort. It's not something that's going to happen overnight. So you're seeing. I keep using athletes as an example because they're a great example, and the resilience that they have is trained, and it's something that they've learned along the way because they didn't become a professional athlete overnight. Much like us, much like you and I, business owners, to get to where we were and to where we are now, it was years of practice, years of learning, years of setbacks, years of learning from those setbacks and saying to ourselves, okay, I'm not going to make that same mistake again, and learning from that. A lot of that is kind of like insults, if you will, and building into our brains and our bodies resilience. And it's resilience training. So, what I try to implement in my own practice, and just with the accumulation of my experience as an executive over the course of the last decade, your mindset is a make it or break it, because you could have the best team in your practice, in your construction company. You have such a dynamic team at AFT. You could have a fantastic team in, as the like local basketball team. But if you've got somebody or a good number of people that are your 20% that are taking 80% of your time, it is something like you said, it just drags everybody else down. So you've got to be very mentally capable of over kind of over consuming yourself in a way where you are dedicating yourself to this consistent nature of, this is my plan of action, this is where my goal setting is going to be, this is where I want to hit this year or in the next 6 months, even in the next 90 days, taking small steps to those goals and building on that. But resilience takes time. It is something that it can be learned. It needs to be taught by whoever it is. It could be a coach, it could be your executive coach, it could be your therapist, it could be your psychiatrist, but it is something that we all have within us. It's just a matter of the dedication you're going to put into it. And that's kind of the reason why I built my practice kind of as like my baseline, because I know how it's been as an executive to get to from 0 to 60, and it is not something that is very easy. It's not something that your network of people closest to you may or may not understand, and so you have to have an understanding of ultimately where you want to be, who you want to surround yourself with, building on that resilience, building on that dedication, training your mindset to maybe change, be more confident, self-assured, all of this. It's everything in between. So yeah, I think that even if you were someone who was so dedicated to the gym and really wanted to hit this particular goal in mind and your strength training, and you couldn't do it on your own, for example, you had to hire a personal trainer, that doesn't mean that you failed on your own. You just needed help, and you just needed a little bit of a coach, if you will, to help you get to those goals and attain those. And athletes, executives, all the people in between, celebrities included, everyone has some sort of coach or a network and body of coaches, whether that's within their network, that maybe it's a family member, acquaintance, and somebody that they can turn to as a mentor, or it's somebody that's been in the field, that's been dedicated, that was a coach for, let's say like your QB coach, that's who's dedicated to you, getting you to where you need to be on that team through the course of the year. And executives included, children included, they have tutors. That's what builds their confidence up, and then they get more successful along the way.
I love that. And I want to touch on 2 points you made. You said one,
Mm-hmm.
which I'll come back to. You said plan of action, small steps. And then the other one was who you surround yourself with. And I thought that's interesting because, we definitely don't want to surround ourselves with yes people, right? We want someone
Right,
to push back, but at the same time, you don't want to surround yourself with negativity, right? There's a lot to
right.
do with, and I remember being super young. And a coach I had in high school, and he had talked about that. Yeah, it's who you surround yourself with, right? That's who you kind of take attributes of your inner circle, and if you're aspiring to be a certain level, you got to surround yourself with those type of people. But the plan of action I thought was interesting because, again, I know for anyone that needs them, an expert, of course, Dr. Mona, you're there for him. But I had a mentor that early on, and he was a pilot, and he said,
Mm.
Brad, I remember him teaching me this about just negative thoughts. He said, look, Brad, I was a pilot, and as a pilot, there's a checklist. You get in the cockpit and you have this checklist you run through every time, and it's mandatory. Anyone that's flown or is a pilot, they understand this checklist, right? Because there's so much safety integrated in going through this checklist. And then he also enjoyed woodworking at the time. This is before I was in construction or,
Mm.
where I'm at now, but he had a woodworking company, and for fun, he had this sign up in his wood shop, and it said, "Is today the day that I cut off my finger?" And essentially, and the reason he did that is because there's a lot of accidents that happen around the table saw
Yeah,
and the router and everything he's doing in the
sure.
workshop. And so he would always have this checklist he'd go through in his workshop before he's doing his woodworking, just like he would as a pilot. And the correlation he would say, Brad, in life, negative thoughts will come. They're going to come into your mind. And as us as humans, for some reason, we tend to stew and, consume ourselves with the negativity or the stress or anxiety, or maybe there's a litigation hanging out there. Maybe there's, a project didn't go right. Maybe there's someone who's upset, whatever it is, we tend to dwell on that. And he said, your mindset's really important, that you, as those thoughts enter that negativity, that you're going through that checklist, like going through these items. Is it a song? Is it a happy thought? Is it a family? Whatever it is, this checklist that kind of takes your mind outside
Mhm.
of this negative spiral. And then now you can put yourself in a very healthy environment mentally, right? And so when you were giving that example, that's something that just came to my thought, from 20 years ago,
Yeah.
about and I'm sure you have many more techniques than anyone, of course, at the end of this, they can get your info to consult with you. But, how has that played a role for you when you think about just your mindset? You mentioned, hey, you're an executive, right, Dr. Mona, and you've built your practice, and
Mhm.
you're going through the same thing that you're educating and teaching us on individually, building your practice.
Right. I love that story you share because he almost had, and I don't know if he had any therapy or form of that in the past, or maybe read books or on psychology, but he almost in a way was incorporating and implementing a therapeutic strategy, kind of like a cognitive behavioral strategy, where when we have these persistent negative thoughts that come in our mind, we're trying to shift that focus with something else, whatever it is that makes us happy. And that could be music, it could be uplifting music, it could be some hobby that you really like, that you enjoy, that will shift your mind and attention to that for however long, however many minutes or hours. So I love that. I love that. And hopefully you took that on and utilize that through your course of the last couple decades. Negative thoughts are, it's ingrained in us, and the reason is the human brain and the human functioning. I mean, early on ancestrally, when we were like almost primates in a way, we were always tending to watch out for the most fearful moments and be mindful of that, right, to prevent anything from happening. Much more significant than just loss of a finger. I mean, it's loss of life. Some prey or predatorial thing might come after you, and so we always have to be prepared. So we are wired for that, and that is fortunate yet unfortunate. So if you're wired for that, and you don't have something to offset that, whatever it is, to offset those intrusive thoughts and that persistent negativity, it's going to weigh you down. It really is. And in any form and every form of the word. So we try to teach that, and we try to implement, okay, what are some strategies? And this is actually why a lot of executives go through therapy or some sort of mental health coaching, because a lot of this is popping up in their minds. And it's not just within their workspace and what they're doing on a day-to-day basis, but it's also their interpersonal lives. It could be related to their relationship with their significant other, their family dynamics, all of that. And so it's all intermingled, unfortunately. But I've been in the administrative and executive realm for somewhere, along the way over the last 10 years. And I'm also CEO of a telehealth company. I can talk about that as well. So I'm doing kind of two things, very dynamic in nature at the same time. And these thoughts come up. You're going to have conversations with others that, why are you doing it in this way? Why did you start it in this manner? Oh, you're too expensive, or oh, this, oh, that. And these can weigh you down if you allow them to weigh you down. What I always tell people, and my mindset has always been, you don't want to share everything until the doors are open. Um, and that can be in any sense of the light. So you don't want to get that negative energy in before you get started into something. You don't want to invite that in, because it's only going to grow those weeds of the negative thoughts in your brain, right? So that persistence is key on utilizing some sort of hobby or a music or whatever it is that is helping you to offset some of those, and supporting yourself with the dynamic network that you need to help you. So when those negative thoughts are coming into play, you nudge your spouse and say like, hey, this is what's going on, what do you think about this? Or your mentor reaching out to your C-suite, if it's not a group of yes men or yes women. Like, you need some of that dynamic nature in those conversations. And that's why when you were talking about the importance of having the right network around you, that is really key, because everyone is supportive of one another. And that doesn't mean that they are yes men or women. It just means that they're hearing you out. They're giving you some sort of, confidence and benefit of one another. You're learning from one another. And those are the best friends. Those are the best acquaintances. Those are some of my favorite moments of just, hanging around a lounge and sitting around with our group of friends and just talking about business ideas or where we want to be and where we want to be in 5, 10 years from now, not just kind of sitting necessarily in the past. Mindfulness therapy is also the strategy too that is very related to what you were mentioning, about your mentor. That's where you're kind of living in the moment and enjoying the moment and not always looking towards the future. We have moments when we're okay to look into the future. It's goal setting. It's very convenient. It's very helpful for people like us that are very motivated and constantly motivated. But sometimes we have to live in the present and in the moment. And that's where the meditation comes in. Whether that meditation is just, lying down on a yoga mat and doing kind of breathing techniques and body scan techniques, but it could be anything. For me, I'm completely one of those people that is like, I need EDM or house music to help me unwind. So I'm not like a spa healing type of music with a sound bath. No,
It's a little bit
I
more
get
energetic.
really a little bit more energetic. Yeah.
It's funny you say that, but what's interesting, I've always tried to, I think many of us, as we associate with others, and throughout life, walks of life, and I've always tried to look at people and be like, okay, certain people are like more happy than others, right? They're more
Hmm.
happy. As you mentioned,
Right.
I wrote down this term, this mindfulness therapy, which essentially, I think a lot of that has to do with perspective too, right? I found that a lot of people that are happy, to your point, they have a lot of very healthy perspective. And what I mean by that is that it's very easy to live in the society where we compare, or
Hmm.
life's not fair, or I was dealt this hand. There's always things each of us have that may be holding us back to some extent. And the ones that always have perspective to say, yeah, it could be worse, or they kind of have this understanding, as you mentioned, where it's like, a good example is when we're teenagers, right? I can't wait till I'm 16. I can drive. I
Oh
have
yeah.
some freedom. Okay, well, now I can't wait till I'm 18. I'm out of my parents' house. I can't wait till
Yeah.
I'm done with college. So you're always looking like, I'm going to be happy once I get here. Once my business gets here, I'll be happy. And so there's this continual thing that almost brings us down, that we're not enjoying the moment. We're not happy that we're 16 because we're 16 and we
Yeah.
don't have the stresses. And it's hard to have that perspective at 16, but I think a lot of us fell to that as adults. And I've seen that people that are happy tend to really live in the moment, as you mentioned. Of course, goal planning is essential. And you mentioned, even with your peers, you're going to challenge each other, women, men, that, hey, here's where we want to be in 5 years. But at the core of it, you're happy where you're at today, Dr. Mona. And
Yeah.
I think that's a huge separator for sure.
Huge, huge. It's so pivotal. And because if you think about it, just like take a moment to kind of, I guess, even where I'm sitting right now, to breathe in and really intake the moment that we're in right now. I mean, I personally have been following you for years and your construction company, and see you just shoot over to the moon. And I am loving it. I absolutely love AFT. I
Well,
have
thank you.
seen, yeah, absolutely. There's I counter my spouse in a way. We always talk about yin and yang, and I think to have a really great successful relationship, you kind of need that yin and yang in the marriage. So I like living in the moment. I love living in the moment. I am very future forward, very future oriented, goal oriented, have always been, and almost to a fault. There's a perfectionist quality in there that, if you don't hit your metrics, if you don't hit those KPIs, you failed, and you can't think of it in that way. And I learned, probably about halfway into my career after residency, that that's not going to be the case. You can't put a number on things. You can't put a number on life. There's going to be a lot of ups and downs. Nobody could predict a pandemic, and shutting down the world, not let alone like your local cafe and schools. And no, it was the world. And it doesn't matter who you were, where you were, how many kids you had. I mean, everybody was in online school at that point, right? So what do you got to do? You have to live in the moment and just really make the best out of it. And you're absolutely right. And I say the word resilience again, because you saw the most resilient people do really well during that time where everything was shut down. They may not have had a lot of interpersonal relations or meetups with their friends and colleagues and everything, and much more of their life was done remotely. Or it was a great process for an introverted individual, but for most other people it was really hard. So what do you make out of that? It's just the dynamic nature of every human and every individual. And I always say every one of us has a story. We all have a backstory. We could all write a book, and it could be about our lives, the stressors about our lives. We've all had something occur to make us who we are today, whether that's good or bad. It's a matter of how you want to end that story. Where do you want to go from there? And at the end of the day, that's kind of how I live my life. That's how I hope, that I relay that message to my patients as well, because you have to enjoy where you are at right now. We don't know what's going to happen tomorrow. And how many stories have we heard where you had a loss of a loved one, or, you're grieving, even if it's your pet or someone that was more of an acquaintance, that they lost their life too early. And, you just don't want to be put into that spot. Enjoy your time now, wherever it is that you're at. You will grow. And if you have that mindset that you will grow, it can be a little bit, slower but you're intentional with it. And when you have a good mindset and have a good heart and the compassion for it, you will get to that goal. I truly believe in that.
And I believe, you being an expert makes you more empathetic too, because having the MD mindset like you had, especially
Mm-hmm.
where, so formulaic in a way, and then you've had the realization of, hey, I need to live in the moment. I mean, you've
Yeah.
been through that personally. And so as an expert for someone such as myself to come in, it just makes it that much more valuable. For those
Right.
listening, as they're thinking about, okay, there's definitely some of us that, at different levels, right, of mental health and wellness and, different aspects there. Where do they look? Resources, such as yourself. I mean, you're here in Scottsdale, but for ones that are in
Yeah.
other parts of the country, I mean, why, not only how do they find an expert such as yourself, Dr. Mona, but more importantly, the value add for them to have a mental health
Mm-hmm.
advocate, right, that's working with them in their business, how that can impact their life, their business, their family relations, just everything.
Absolutely. There's so many different modalities of finding who you need as a mental health professional. So we've got different types of mental health professionals out there. We have MD psychiatrists such as myself. Then we have psychologists who could be PsyDs or PhDs. They only do talk therapy, although in certain states they do have qualifications to medically prescribe medications. And then you have the counselors slash therapists. And a lot of those, it's dependent really on what you're looking for. If there's somebody out there, that has questions about, for example, I've got depression, I have anxiety, I have sleep issues, I have all this other stuff intertwined. Do I need medications? Well, you would go kind of towards the path of finding a psychiatrist. So that can be a MD or a DO. There's also mid-level providers, nurse practitioners, and physician's assistants as well. Then if you're talking about more talk therapy, so cognitive behavioral therapy, other forms of talk therapy, PhDs, PsyDs, counselors, therapists, they kind of do more of that. And that's strictly what they do in their own practice. So the way that I built my practice was everything all intertwined under one roof. And the reason for that was I saw over the accumulation of years that patients really do well when it's the most minimal provider possible, because then they don't have as many people to follow up with, and those people are not necessarily talking to one another and collaborating with one another. If you think of yourself, you are the contractor. You've got subcontractors kind of under you, and then they might have subs under them as well. It's kind of like a pyramid. Well, psychiatrists kind of fall at the top of that pyramid as well, and we medically manage patients, but we can also perform talk therapy and do talk therapy with our patients, as well as interventional strategies too. And then we've got the therapists and counselors and PhDs that kind of all fall under that realm as well. But it's a collaboration that doesn't always exist out in the market and in the free world right now. So I built my practice so that me as a solo provider, somebody can come and see me, and if they wanted meds, great. But if they didn't want medication, I'm still giving them the capability to have talk therapy. We still do the medical kind of purview of things like lab work, IV supplementation, oral supplements, things like that, to kind of treat the whole holistic well-being person. But they would have to kind of dwindle down and dive into what they're looking for. Then they can look locally or under their insurance panels as to who they could see. But if they're looking at self-pay, which is kind of how my practice is run, without any insurance, they can go online, they can Google somebody, psychologist or psychiatrist near me. A bunch of these analytics will pull up, and then they can kind of go from there as to who they want to choose. And it's a difficult field for people to really feel comfortable with their doctor. So it's all about building rapport, meaning you really have to be comfortable with providing all of this confidential and private history about yourself to that individual. And if after 1, 2 sessions or so, you're not feeling the vibe, if you will, if you're not feeling comfortable with telling your story to this individual, you have all the right to seek somebody else. I think that's where people get stuck, because they feel that I have to see this therapist because they're the one that I chose first. And I have to go through 6 or 12 sessions, which end up being sometimes a half a year or a year. And they haven't gotten benefit in any which way for that reason. But they stuck with it thinking that that was their only option, when there's so many other options out there. It's really a matter of who you want to see, what type of provider it is, and their specialty credentials. Some are even credentialed and specialized in a way where they are just tackling ADHD or just tackling, couple relationships or something like that. And so you can even get down to the nitty gritty and search for them in that manner.
It's such good perspective. And I love that you shared just not just the complexity, but the realization of it, right? I mean, part of it is, as
Mm-hmm.
you mentioned, there's a personality aspect. So
Right.
having a great rapport with your therapist, can work wonders. And yes, it's okay to transition if you feel that they're not meeting your needs. And then from, as you mentioned, from the talk therapy to the medication side. What's interesting, because even as you're giving some examples and you're talking about,
Hmm.
anxiety and depression, and some people have social anxiety. So some of us may not even realize that maybe there's a mental health element to us, right? We may,
Yeah.
have some social anxiety going to a networking event, or,
Right.
but even more so, maybe certain things are making our stomach hurt, or we have like physical ailments because like our mind is controlling, as some people get anxious and they have these other elements that lead up. So all these things essentially is why someone should be saying, okay, Dr. Mona, let's work through
Right.
this, because it could be short, it could be long, but there is light at the end of the tunnel.
Absolutely. I think, I'm the kind of person where if you've got something going on, there is no way I'm going to say, here's what you're diagnosed with. That's your label. That's your label for the rest of your life, because you'll never be able to tackle that later on in life and remove that from, your list, your checklist, if you will, this hypothetical cloud that's sitting above you. That's not true. You can work on social anxiety. There's so many things that, with a lot of work, with a lot of attention, and with a lot of support, you could be doing really well at a networking event in just another 6 months or less, or more, just dependent on how severe the case is. I think that it's about the who you are, what your demands are in life, where you're at. Everything can be addressed, and there's so much about anxiety alone that people just don't understand per se, and there's a lot of psychosomatic nature to anxiety that we can't see if you're not in the medical field. It's everything all coupled into one, right? So our minds are obviously connected to our body. So your sleep can be dysfunctional. If anything is off, even on your vitamin levels or thyroid and whatnot, that can be throwing things off, and that could directly attribute more mood disruption and cause some depression, cause sleep disruption, cause you to feel fatigued more easily. And these are things that we don't necessarily understand if you're not in the medical field, because it's something that, like, man, I am just so tired today, but it's been in the last 2 months that I've been tired every single day. Must be stress, must be this, must be that. But there's 99 things going on in your life. And then there's another added stressor every single day that's just piling up, piling up. And what happens is we kind of, especially in today's society, right? Everything is handled by yourself, and it's a lot going on all at once. And we've found that we are taking on way more responsibility maybe than we can handle. And it's a problem that I think women have a lot more of, because we just yesterday we were talking in a networking group about how women don't have the capability sometimes to say, I need help, when they need help, because they're too shy, or it's a societal issue that we kind of break down, and we're fearful of that. I need help because, or I need help for, it's like the three words I need help doesn't almost exist in a female's language, in her mind. You've got to kind of break through some of those barriers. And some of these are generational barriers we deal with culturally or society or whatever it is. It exists. It exists mainly because we haven't worked on it, but now's the time to work on this. Now's the time that when you find out that the anxiety exists and it's causing some disruption to your GI, your stomach, and it's, causing a lot of little issues, which are ending up to be irritable bowel syndrome down the way, and all of these other things coming about. The underlying issue was always anxiety. And how many times have patients come to me with this laundry list of medical issues that were all related to either anxiety or depression? And once we tackled the underlying main disorder, everything else started just, we were peeling back all these layers, and then no longer had IBS, no longer had sleep dysfunction, no longer had insomnia, and some of the other things. So it is very important for sure.
I love that you gave that example because, treating anxiety with you, Dr. Mona, now essentially all these probably other medications and doctor visits and
Hmm.
I mean, health issues that come from it, I mean, all those can essentially be wiped away, right? Once you get down to
Yeah,
the root cause.
yeah,
How, what advice would you have, or are there not even advice, but maybe there's common traits? And what I mean by that is a lot of us maybe have had someone close to us that has dealt with mental health, and you never want it to where it gets too late because a lot of them won't speak up, and
right.
you never notice that maybe a coworker or an employee or family member may be dealing with certain things you don't know. How can we maybe be more acutely aware of what's around us and those that are close to us to see maybe signals that, hey, maybe they're dealing with something, and um,
Hmm.
how can we help?
I think one of the easiest things that you can see, in a way, I mean, it's not going to be for everybody because some people put on a really great face, but depression is probably one of the easiest ones that you can see manifesting and kind of brewing in somebody. Some of the times you'll see that there's some instigating factor. So they lost somebody close to them, or they lost a job, something as simple as that, or something happened, or they were demoted and things have just shifted in their life. They're what they foresaw in their path and in their book, if you will, wasn't it's not playing out. And that's what makes them really upset. And then they get isolated. If you're noticing that somebody is isolating, somebody that was always in your networking events or really outspoken in your team meetings, for example, and you haven't heard really much out of them the last week, 2 weeks, months, you can check in on them. I would say it's so much better to do it individually. Oftentimes we kind of pull them aside and say, "Hey, like, how's it going? How are you doing? How are you feeling?" You don't say, "Hey, you depressed? Hey, you sad?" Nothing like that, because immediately that's going to trigger an alarm in their brain that they're, oh my God, I'm looking like I'm depressed, or I look like crap. Whatever it is that I'm manifesting right now is exuding physically or emotionally, and I can't do that. So then they're going to put on a facade and all of that. It's got to be intentional, and you have to show empathy and compassion to them. Otherwise, there's nothing that's going to come out of it. And it might not be after the first time, it might not even be after the second conversation you might have. You might check in on them via text or leave a voicemail or something like that and see how they're doing, stop by their house. Obviously, if it gets so severe and they're talking about feeling worthless or wanting to end their life, it gets to the point where, we have a conversation with a medical professional. Do they need psychiatric treatment? Do they need to go to the hospital or an ER? That's a entirely different conversation. But it's really great to check in on your colleagues, your peers, your acquaintances, family, friends, when you see just some sort of change in them. And it could even be just a really bad anxiety, or they're dealing with a really bad trauma leading to insomnia or something along those lines. You might get a little bit of info, but you can always do a little bit of fact finding, if they allow you, but you can always share information as well. So, hey, I was listening to this podcast the other day, or hey, I had this book and I wanted to share it with you. And maybe that would enlighten them to read it or have an audiobook and have some understanding of maybe what's going on within them, because they might not even know that that's the situation going on, and to seek help
I
because
like
they're too
the
scared. Yeah.
Yeah, and I like the angle you're giving about asking questions and
Yeah.
recognizing even little things such as isolation, which could lead to that.
Hmm.
Um, where does the passion come from? It sounds like, I mean, I know having known you, Dr. Mona, I mean, you're super passionate about what you do.
Mhm.
When did that start? Especially the specialization to, go into the field of mental health.
I Gosh, I started college and I went to Arizona State. Woohoo! Sun Devils. So I went to ASU. That's actually where I met my husband. Although we knew each other early on, we started dating. We got married by my sophomore year, so we were
Oh,
married
wow.
young. But it was pure
Yeah.
love, not arranged or anything like that. So second year, he was actually my first semester of college was his last semester, and long story short, we decided that there was probably no way that we could both get into med school together, years apart, and kind of share the same path if we didn't try to go together. And so after my second year of ASU, I actually went straight to med school, and we went to the British West Indies, which was not, not necessarily common, but we had a great experience. And right when I started med school, at that time I was one of the rare few, probably in the nation, that knew, at least at that time, like, however many years ago, that I knew I wanted to do psychiatry. I was actually always into the mental health game. It was a different realm, and I saw there was so much that can be done futuristically and innovative solutions for mental health and psychiatry. So I actually started med school with the mindset of I want to be a psychiatrist. That's it. Like that's where my path is going to lead, and had that mindset the entire 4 years. And then residency is another 4 years, which I came back to Phoenix for. We had couples matched, and throughout that time, very consistent. This is what I want to do, and kind of dabbling in several different things. And through my accumulation of years of experience, whether it was in admin or clinical, I was always kind of picking up newer trends and ways to talk to patients. And this worked, but this didn't work. In this demographic, this is how I kind of need to discuss this, disorder or this treatment with a particular population, much more so, very differently than this other subset of population. And over the accumulation of years as well, I had so many acquaintances, colleagues, peers, family, friends. I mean, everybody was like, when are you going to open your private practice? We want to send so and so to you. Like, can you see some? I would get texts, I would get calls. Can you see my mother? Can you see this? Can you see that? And I was like, no, no, no. And I shied away from it for many years because I was always in the mindset of there's much more to a psychiatrist than just doing med management, 5-10 minute, visits, not really getting to know my patients. I need to know the story, because if I don't know the story, I can't treat the underlying factors. And that's psychiatry. It's a story. There's a background to every single patient and to where they're at today, because you can help them get to another step, to get to another goal, to get out of this funk, and build on really great relationships with their spouse and the dynamics with their family, their peers, colleagues, work. Why not be a part of that? And that to me, that's where I'm at. That's what really hits home. I really want to help patients. That's where my passion is really, I want to see that change. And I always tell patients, it's not going to be overnight. Even our medications in psychiatry, it's not an antibiotic. You're not going to see a result in 24, 48 hours. You're going to see a result once you're consistent with it, take it, and we see maybe about a month and a half later or more a little bit of the results out that come out. And that could be treating any sort of disorder: anxiety, sleep, depression, schizophrenia, bipolar disorder, whatever it is. I just love the field. I read the books. I used to, when I was in elementary school, middle school, high school, there was always books that I was like reading that always had some sort of psychological undertone. And it was intriguing to me to see as an adult why I like that, but that kind of prepared me for my career path and why, my passion is where it is today.
I love that. Well, it shows in everything you speak about and, your
Yeah.
practice, that passion so important to it. Um, and I think it's interesting because, as you mentioned, there's so many pressures from culture, society,
Oh,
genetics.
yeah.
I mean, all these different aspects. And you also touched on telehealth. You're doing that too. So how has that maybe changed the game, or how have you incorporated that aspect into the practice?
Sure. I started telehealth. I was a big proponent of it here in the Valley back in 2015-ish. And that's when things were still really, it was not in its infancy because there were actually a lot of telehealth companies that were very successful, but it was a subset of not necessarily mental health that they were doing. Um, After the COVID pandemic, I mean, telehealth just shot through the roof because there was no other modality to treating patients. But I love it because I can see my patients and meet them in any circumstance. So you're sitting in your office, we can have a meeting right now, and then you jump on your Zoom call with your board of directors in just thirty minutes. You're not commuting to me, not necessarily, saying that it's a burden to do so, but why not meet the patient where they're at? Because it's psychiatry. I don't necessarily need to have a physical examination with you. So why not open this up as a modality for seeing patients? And in my practice, I've incorporated that hybrid model for that reason. If I have an executive or even a student, wherever they are at, they can carve out the 30, 50, however many minutes a month for me. But if they want to do it in person versus virtually, I can be accommodating to both. But most of the time, people are like, "Oh, I'll see you virtually. Yeah, I'll be in my office, or I'll be in my home office, or I'm just in between certain meetings right now. I can hit it. I'll see you from my living room." I've seen patients with their newborn babies kind of in the corner sleeping, and we're doing a patient facing interview. I mean, it's so convenient. I think it's lessened the mental health stigma because you don't feel like you're walking into this like dusty psychiatrist office. You feel a little bit more at home, more comforted, and I'd love kind of delivering that care modality for that reason.
How has the business, changed over the years and even from the very beginning, what do you wish you knew when you started your company? Now you have a lot of expertise running the firm, but, from day one.
Oh, there's so many. um, I feel like one of the things that I think I've learned along the way is that negative self-talk, you need to just quash it. Just quash it. You don't need to talk about other kind of negative things going on in the industry. Do your own thing. And one of the things that I've mentioned to others as well is there are a multitude of different cafes out there that serve coffee. They're successful coffee shops. We've got Press Coffee, Coffee Bean, Starbucks, everybody. They're all competing with one another, but competition is relative to how competitive you are. So if you've got a modality and you've got a company and you've got a practice that is catering to a niche, continue with that. There's no reason why you need to pivot or go elsewhere just because there's another competing entity or another office or another construction company. You do your own thing. All of the word of mouth and all of the networking, people will get that over time that no, this is the dynamic company that is doing it right. This is who I love going to. So that is my coffee shop. That's who is catering to me. I love their oat milk latte. That's who I go to every morning. As opposed to other people may really love another coffee shop and they might go there. But everyone has their own position in life. And it's got to be your understanding that you need to be full fledged and dedicated and goal driven to just get to where you want to be in your business and in your practice, in your life. And just don't mind the other static noise that's coming from around you, because there's going to be a lot. There is going to be a lot. But if you surround yourself with really great mentors and people that have probably already been in the game, or they've coached the game, they've been on these teams on the winning side before, they're the ones that are going to say, like, yeah, you're doing it right, but hey, can you maybe pivot in this manner and maybe adjust your process in this way, or adjust your policy in this manner to cater to a bigger subset and crowd. And that's really what we're seeing a lot of with like PE firms and VCs, right? They come in, they have these consultants, they're taking a look at your strategies, they might change things around a little bit of your company, but at the end, it's kind of like, I want to stick to my guns. I want to continue to be bootstrapped for this very reason. And that's what we did with my other company. We're bootstrapped. We're very driven. We know we have a really great model for telehealth and telepsychiatry, but we know that as soon as some outside noise or outside entity comes in, they're going to want to change the entire game. And I'm not willing to drop my quality for that reason. So that's it. I mean, you're going to have other people and entrepreneurs that have a very different mindset, and that's okay. That's how they work. But that's how my mind works.
Well, the fact that you have those standards, you're not going to drop that quality. I mean,
Yeah,
it just speaks to you and the brand you've built, right? Which is a huge part of that.
right.
So what keeps you up at night now?
Um, I just opened my doors about less than 2 months ago, so a month and a half ago, of my private practice. And it's just a matter of what I need to do to get the word out. Doing some more social media. And I am an avid believer of networking, and especially in person, that once you see individuals and they, especially in this field and in this industry, they really need to see who you are and how dynamic you are. And if they can really talk to you, because you don't want to be shut off. You want to be who you are and be open and honest with people, but you also want to attract clients and patients. And it's a business at the end of the day as well. So just, it's just a matter of a lot of networking right now for me, and getting the word out, and, doing these types of interviews and podcasts. And I feel like I'm really in a really great spot for myself in terms of my niche, because I love what I do. I try to exude that in everything that I do. I mean, every element of my practice is me. I mean, the entire interior design of my entire office and space was me. The way that I have conducted business is really me. And yes, I have an executive coach. Yes, I have other, networking individuals that have helped me. But at the end, it's all about my vision and executing my vision. And I mean, anything and everything can keep me up at night, but I still need my sleep. So I do get sleep. So I do have to get that rest. But I mean, that's the space that we're in. You're an entrepreneur, you got to have that. It's that dedication. And I know this vision, and I'm a very different model than really anybody else out there, but I always like to stay ahead of the curve. And that's what I've been told. So I'm sticking to my guns and believe that this model is the wave of the future, much like, how I adopted telehealth like in 2015, when not a lot of people were believing in it or doing it.
Well, you have to be the trailblazer. Someone has to do it,
Yep.
Dr. Mona. So,
Yeah. Yeah.
so
Yep.
along those lines, I mean, you mentioned that you sleep well. What do you do for fun?
Oh, wow. Go to festivals, like music festivals with my husband. Traveling for like a Vegas weekend here and there is a really great time. Family time. Sometimes it's just about vegging out at the house and hitting the pool, watching movies, reading. I love listening to music. I am a cross between hip hop and EDM house music. So it's like a really vast difference, but it depends on my mood. So I can be all over the place. I love local sports teams. I mean, man, I was going to a lot of the games when Suns were in the finals. That hit me really hard. It hit the family really hard.
Yeah,
Cardinals and everyone. So, but yeah, being a
that's awesome.
being an advocate for the local community too.
Well, that's huge. Well, for those listening, as you mentioned, you open your practice now, Dr.
Yes,
Mona. Where can they find you? How can they get a hold of you and contact you moving
sure.
forward?
So I'm on Instagram. It's Mind Over Manolos, Manolos. I also have my website that they can go to. It's www.mindovermanolos.com. And most of the information is there. They can book a discovery call, which ultimately is like a few minutes of just getting to know one another and seeing if they would be a good fit for the practice, and if just so that they can have a fine tuning kind of understanding of my model, since it does differ from the rest, and going from there. And if it doesn't fit, I can give referrals and help to steer them in the right direction, because I don't want to leave anybody at with zero help.
Well, you've been amazing, Dr. Mona. Can't thank you enough for coming on. So
Thank
appreciate you
you.
making time.
Thank you for your time, and I've enjoyed this experience, and thank you so much, Brad.
If you get value from the show, please support us by giving a 5-star rating and review on whatever platform you listen to. And I also have a favor to ask. We've had some incredible guests that come on and share their wisdom, their knowledge about their business. So if you have friends or family members that could benefit from those episodes, please share it with them, as well as any other business owners that you're networking with that could get value from the podcast or certain episodes. Please share those as well. Again, subscribe, make sure you're following. Any questions that you have, topics. We've had listeners reach out about certain guests that we should have on the show. Again, brad.l@aftconstruction.com. Email me for topics to address, guests that we should have on, and even if you think you'd be a great guest for the show. So again, thank you for all your support, and we'll see you next time.